Hi all, welcome to FASTCODER21 Medical Coding YouTube channel. The purpose of the channel is to help the people who are in need of medical coding reliable resources. If you are already subscribed to our channel, help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive latest updates in the medical coding field. This channel is helpful for freshers, experienced coders, aspirants of AAPC certification exams and HEMA certification exams. If you have any other topics or concerns, please mention in the comment section. Please click on like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CM, CPT, ICPICS coding systems, as these Q&As are very useful in live coding, medical coding interviews, AAPC and IHIMA certification process. Guys, if you go to any interview or certification exams, kindly keep familiar with code books like ICD-10 CM, CPT, ICPICS, as our sessions will assist you in the process of interviews, but not an alternative to original interview process or certification exams. Today's our topic is AAPC Certified Inpatient Coder Preparation Session 1. As we are getting frequent requests from the subscribers to create this topic, we are started making sessions of CIC certification process exam. First question, what is a critical access hospital? Medicare beneficiaries in rural areas can receive services from critical access hospitals. Critical access hospitals offer emergency services, inpatient rehabilitation, and psychiatric services. Critical access hospitals can have no more than 25 inpatient beds used for either inpatient or swing bed services. So basically, these critical access hospitals are created for rural areas. So all these hospitals are having emergency services, inpatient rehabilitation services, psychiatric services. Usually these hospitals have 25 inpatients bed. Next question, what is PDPMs? Medicare Part A payments are made for inpatient hospital stays through Medicare Skilled Nursing Facility Prospective Payment System, utilizing the patient-driven payment model payment classification. So here, in order to get payments for Medicare Part A inpatient hospital stays using patient-driven payment model, Medicare Part A payments will receive money from the Medicare. Next question, how many claims are generated if provider perform procedures in the inpatient facility? Answer, when providers perform procedures in the inpatient facility, two bills are generated. One claim is for the facility services which are submitted on UB04 or CMS 1450 paper claim form or electronically using 8371 institutional claim form, while the other claim is for the physician services which are submitted on CMS 1500 paper claim form or electronically using the 837P professional claim form. Next question, how many claims are generated if provider perform procedures in the outpatient facility? When procedures perform sorry, when providers perform procedures in the outpatient facility, two bills are generated. One claim is for the facility services which are submitted on UB4 or CMS 1450 paper claim form or electronically using the 8371 claim form, while the other claim is for the physician services which are submitted on a CMS 1500 paper claim form or electronically using the 837P claim form. So here one is for facility, one is for physician claim. So whenever outpatient procedures performed by a physician, it will generate two claims. One is for physician, one is for facility. What is two midnight rule? For Medicare patients, the inpatient hospital admission is generally considered appropriate when the patient is expected to need two or more midnights of medically necessary hospital care. A patient who has a procedure on the inpatient only list will be admitted as an inpatient. However, such a procedure is not required for the stay to be considered an inpatient. Next question. What is the requirement of teaching hospital to train physician? Teaching hospitals needs to affiliate with medical school to train physicians. Who is an intern? Interns are usually in their first year following graduation from medical school and are completing a 1 year rotation in various specialty departments of the teaching facility. So next question, how does inpatient hospitals get payment for services? Inpatient hospitals gets payment usually using inpatient prospective payment system utilizing the Medicare severity diagnosis related group methodology. Usually we'll call it as MSDRG. Next question, what are included in HAM department? Usually HAM departments means Health Information Management Department. The Health Information Department includes sections for coding, chart construction or organization, transcription, release of information, birth and death certification, scanning or filing to input information into charts, and other sections required to maintain a consistent flow of patient information throughout the hospital or facility. Some hospitals, facilities, and medical organizations will contact with transcription services or release of information companies. What is a Type A emergency department? Answer. Type A emergency departments meet the traditional definition of an emergency department as they are hospital based, open 24 hours per day, 7 days per week for immediate, urgent, and emergent care. What is personal supervision? Personal supervision means the physician must be in attendance in the room during the performance of the service or procedure. Next question, what is CORF? CORF means Comprehensive Outpatient Rehabilitation Facilities. What are included in Comprehensive Outpatient Rehabilitation Facilities? Covered services for CORF include provider services related to administration, physical therapy, occupational therapy, speech therapy, respiratory therapy, social and psychological services, prosthetic and or orthopedic devices, supplies, and drugs and biological that can't be self-administered. What is an order? The facility must have an order from the physician to perform a diagnostic test. The order needs to include the test to be performed and the reason for the test. So whenever physician planning to order a test, he needs to have mentioned everything on the document, which we will usually call it as an order. So next question, what are included in NPP? Usually NPP means non-physician practitioners. So NPPs include physician assistants, nurse practitioners, certified registered nurse anesthetists, clinical nurse specialists, certified nurse midwives, clinical psychologists, and licensed clinical social workers. Next question, what is root? The root is the word part holding the fundamental meaning to the medical term, and each medical term contains at least one root or base word. What is blepharoplasty? The root blepharo means eyelid, indicating a blepharoplasty is performed on the eyelid. What is salpingo-oophorectomy? The root salpingo means oviduct or tube. The root oophoro means ovary. The suffix ectomy means excision or surgical removal of. The pairing of salpingo with oophor tells you the procedure was performed on the female reproductive organs and not the auditory systems. Next question, what is peronechia? The root onychia means nail. Peronechia is inflammation of the nail fold surrounding the nail plate. Next question, what is subfacial? The root facial means fascia. Subfacial is beneath the fascia. Fascia is a sheath of fibrous tissue covering individual skeletal muscle or certain organs. Next question, what is tracheostomy? Creation of a hole in the trachea, like artificial creation of a hole in the trachea. The root trach means trachea. The suffix ostomy means surgical creation of an opening. A tracheostomy is surgical creation of an opening in the trachea and is used to help the patients breathe. What is leukocytosis? Answer. The root leukocyte means white blood cell. Leukocytosis is an increase in white blood cells which can indicate infection in the body. Next question. What is glossectomy? Answer. Surgical removal of the tongue. Glass means tongue. So the root gloss means tongue. The suffix ectomy means excision of surgical removal of. A glossectomy is partial or total removal of the tongue and can be performed to remove tongue cancer or any other abnormalities of the tongue. What is a choledochal cyst? Answer. The root choledoch means common bile duct. A choledochal cyst originates from the common bile duct and usually has symptoms including right upper abdominal pain and jaundice. What is cystourethropy? So usually cysto means bladder, urethra means urethra, and scopy means visualization. So the root cysto means urinary bladder. The root word urethra means urethra. A cystourethropy is an examination of the urinary bladder and urethra. Next question. What is an epithelial tissue? Squamous cell carcinoma and basal cell carcinoma are both cancers of cells in the epithelial tissue. Epithelial tissue is found in the skin, lining of the blood vessels, respiratory, intestinal, and urinary tracts, and other body systems. Next question. What is thoracic cavity? The thoracic or chest cavity is the space containing the heart, lungs, esophagus, trachea, bronchi, and thymus. Next question. What is mucous membrane? Answer. Mucous membrane lines the inferior wall of the organs and tubes open to the outside of the body, such as those of the digestive, respiratory, urinary, and reproductive systems. Mucous membranes are often adapted for absorption and secretion. Next question. What is stratum lucidum? Answer. The stratum lucidum is a clear layer normally found only on the palms of the hand and the soles of the feet. Next question. What is hypodermis? The hypodermis, usually we will call it a subcutaneous layer, serves to protect the underlying structures, prevent loss of body heat, and anchor skin to the underlying musculature. Fibrous connective tissue, referred to as superficial fascia, is included in this layer. Next question. What is a green stick fracture? A green stick fracture is a fracture where only one side of the shaft is broken and the other is bent. It is common in children due to their soft bones. The green stick fracture is named due to the analogy of breaking a young tree branch where the outer side breaks and the inner side bends. Next question. What is pelvic girdle? The axial skeleton includes the skull, hyoid, and cervical spine, ribs, vertebrae, and sacrum. The appendicular skeleton includes the shoulder girdle, pelvic girdle, and extremities. Next question. What are metacarpals? Metacarpals are long bones named for their shape, not their size. Metacarpals are long bones found in the hand that form the skeletal structure of the palm. Next question. What are synovial joints? Most joints in the body are synovial joints. All joints in the extremities are synovial joints. Synovial joints allow for smooth motion within the joint. Next question. What is arthro? The root arthro stands for joint. We will notice in the list of medical terms related to the musculoskeletal system, all of the words beginning with arthro are conditions or procedures related to the joint. Guys, we have completed session 1 now. Soon we will get session 2. So thanks for watching FASTCODER21. Please like, comment, share and subscribe. If you have any concerns, please mention in the comment section. Happy coding guys. Wait for session 2.